Well, good afternoon. My name is Nicole Lee, and I am the Medical School Admission Requirement Specialist at the Association of American Medical Colleges. For those of you who are not familiar with the AAMC, we are a not-for-profit organization representing all 141 accredited medical schools in the U.S., as well as the BSMD programs and the 17 medical schools in Canada. The primary role of the AAMC is involved with research and improving the quality of medical education. I specifically work with the pre-med side of things, so I'm going to be speaking with you about 10 of the most commonly asked questions, good need-to-know items related to the aspiring docs materials and the medical school admission requirements, which I'll be talking about as well. Okay, so one of the first and arguably most important questions that students ask when they're thinking about applying to medical school is medicine right for me? And I've really enjoyed speaking with so many of you yesterday and this morning and hearing about your different journeys and aspirations. There's certainly a lot of different reasons that students are attracted to medicine and decide to apply for med school. We found, though, that the best way to really determine if medical school is right for you is to get some real hands-on experience, and there's several different ways that you can do that. So one way is to shadow a doctor. By shadowing a doctor, you get to see what a typical day is like for that particular physician. You can observe that physician and patient interaction in that particular physician environment, whether that is family medicine or a particular specialty. The easiest way to shadow a doctor is usually to ask your own physician. So that's a great way to just open up that conversation and see if that's an option. If that's not an option, if you're in high school, you may be able to talk with your guidance counselor or a teacher. If you're in college, you can certainly work with your pre-health advisor to see if they can connect you with some opportunities to do that. Okay. Also, getting formal lab experience. If you think that you may be interested working in a lab setting, that's a great way to determine if a career in medical research is something that you're interested in. You can look for opportunities in the summer, particularly on a college campus. If you're interested in working with a faculty member on their research project, you can look for ways to do that. And usually you can find those just on a website or a bulletin board. Volunteering in the medical school field is also something that's going to be a great asset to you. You don't have to have medically related volunteer experience. You know, there's other ways that you can volunteer that will make you a valuable candidate. Just determining ways that you can interact and develop those skills you're going to use as a physician working with patients and interacting with other doctors. I would say that typically when you're looking for something to volunteer in, it's a good idea to find something that aligns closely with your own passion and your own interest, something that you're going to be dedicated and interested, want to do for a long period of time, and really grow in that role would be more valuable than, say, just one day going to work at a blood drive or something like that. You can also work in the medical field, so working in the medical field is going to afford you a lot of those great benefits of maybe getting to shadow a doctor informally and have a lot of that similar experience you would get as a volunteer, but you're going to be getting paid because you're working. There's a lot of different positions you can look into for doing that. One is being a medical scribe. And in that role, you can take notes during a patient interview, complete medical charts, and like I said, get to actually shadow a doctor unofficially. And that's just one of many positions that you could look into. What you see on the screen right now is one of our Aspiring Docs fact sheets. These fact sheets are available on our website completely free. You can just download them and print them out. They cover a lot of different topics. This one, it says, how do I shadow a doctor? So it covers a lot of the things that I've mentioned, but also maybe how to apply, what to wear, anything related. Well, you can find more information that way. So where can I find a pre-health advisor? Most universities have some kind of advisor. They might be a full-time faculty member. They may be someone working with the Career Center, and they can work with you and help you structure your time as a med student. In talking with some of you yesterday, I've heard that some of your universities maybe don't have a pre-health advisor, or you weren't sure if they had one or not. So that's definitely something that you want to look into and see if you can find one. I'll tell you what to do if you don't have one in just a moment. But go ahead and make an appointment, or just go to drop-in office hours as soon as you think that you may be interested in going to med school. It's never too early to start that conversation. You can see different things that you can register for. So you can register for email updates. You can ask if there's some kind of internal newsletter that you can be a part of. See if there's social media pages that you can like, and make sure you're getting any new information that's specific to your university and other pre-med students there. And you want to be sure that you're asking questions throughout the process. So you know your required coursework probably for your particular major, but all different medical schools have slightly different requirements and recommendations for courses that you're going to be taking. So you can talk with your advisor about that, determine how to best sequence those courses so you don't overload yourself in one semester, but are making sure you're getting everything you need to take. With the MCAT exam, you can talk about when would be best for you to take the exam, when is it offered, are there any prep courses at your university that you can take to prepare for that, and then your own academic timeline. So talking with your advisor about how you want to spend your summers and structure each semester going into all throughout your career. And then you want to make sure that you follow up, because even though advisors are incredibly wonderful resources and they have lots of great information to share with you and give to you, they're working with lots of students. So it's important to take initiative and make sure that you are on top of your own requirements and checking in with them regularly. If you do not have an advisor at your university, you can check out the National Association for Advisors in the Health Professions. You can just go to their website, and there's a way that you can apply, and you can connect with an advisor who's not going to be at your university necessarily, but can work with you and help you structure that education. Okay, so how can I finance med school? This is a big question that a lot of students are on their minds as soon as you start thinking about applying, because it is a big financial commitment. But ultimately, I will say that medical school pays for itself. So for an example, last year, the average education debt for students graduating was $175,000, which sounds like a lot of money, but then you can compare that to a salary for someone in family medicine, which is about $161,000. So you can imagine that you will be able to work out a plan to pay for that. There's a lot of great tools that are available to help you manage your debt. First is the Financial Information Resources, Services, and Tools. It's completely free for students, and it can help you determine how you're going to manage that debt. There's lots of loans and scholarships and grants that are available, and when you are accepted to med school, that particular school is going to offer you a financial package, and that may be a big determining factor when you're deciding which school that you want to go to. But they will help you, and they will work with you, and you should definitely check out the first website if you want to do that. And it's important to remember that you don't have to start paying back until after you've completed med school, so you will have an income at that point. So should I take a gap year? A gap year is any length of time. It may be 1 year, it may be a couple years or a few years after you graduate and you have that bachelor's degree before you go ahead and start med school. Students choose to take gap years for different reasons. If you have a particular academic deficiency, if there's a certain level, like if you want to take some upper level courses, improve your GPA, there's options to do that. You may choose to pay down some of your debt, so maybe you want to work in the medical field for a little bit, for a while. You may want to pursue a personal project. And if you are focused on enhancing your academic record, there's a few different ways that you can do that. You can take some time just to study for the MCAT exam. You may consider a post-bac program, which is a program that's specifically designed to support that transition into med school. They might address that particular program you choose to go to, might look at a particular area like studying for the MCAT or improving If you're doing a career change, especially, that might be something that you want to consider. But if you are only interested in taking some of that upper level coursework, there are usually less expensive ways to take classes without enrolling in a formal program. So that's certainly something to consider too. But I would note that, gap years, they are relatively common. We see about half of students who are choosing to do this for whatever reason, and you shouldn't be intimidated or think that you shouldn't do it. And if you do decide to do it, and you just be prepared to talk about that in an interview. So, focus on the strengths that you developed as a person and as a physician, and instead of just saying, oh, I just needed a break, because sometimes you do need an academic break, and that's fine, but there's always ways that you're developing your skills to be a stronger candidate. So what kind of programs are offered? First, here you can see the BS MD program. About 1/3 of medical schools offer some kind of bachelor's combined MD program. And through a program like this, if you're in high school and you know for sure that you're interested in med school, you can go ahead and apply and know that you're going to be in a program that's going to be somewhere from 6 to 9 years. And when you graduate, you'll have your bachelor's degree as well as your MD degree. If you choose to do this and you stay at the same school, you can usually avoid taking the MCAT exam because that won't be part of the requirement for that transition. And the good thing is you're not locked into that program, so if for some reason you did decide that you wanted to go to a different med school, at that point you would take the MCAT and apply, of course, but that's an option as well. If you're really interested in research and you think that you may want to combine research with medical practice, you may consider an MD PhD program. That will strengthen the link between research and med practice. You get to do a career that does a little bit of both. These programs are obviously a little bit longer than an MD program because you're getting 2 degrees, you're getting a PhD as well. Typically they're going to be about 7 to 8 years, but these programs tend to be paid for, which is a benefit. And then there's so many different specialties that you can pursue as a student. This is just a few that are listed here. You may be interested in focusing on a particular organ, so you might be a cardiologist or a dermatologist. If you're interested in that mind-body interaction, you can look into neurology. If you're attracted to the fast pace of medicine, you could be an emergency room physician or a trauma surgeon. It's a big decision, but it's one that you don't have to make for quite a while. Most students end up changing their mind at some point, and you don't have to decide until your clinical years, and then there's an application process for that I won't get into now, but you have time before you have to think about that. And we do have a program through the AAMC, it's Careers in Medicine, so you can see if there's, based on your personal values and interests, they can help you determine which specialty you may want to consider. Can social media hurt my chances of admission? The short answer is yes. In at least a few cases, a medical decision has been reversed. So a student would have been accepted to the med school, but based on an online search, something they found online, they changed their mind and they did not get admitted. So it's good to know that these searches, they do happen, they're legal. It's safe to assume that when you apply to med school, someone is going to be looking and trying to find information about you online. It's important to remember that these searches can help you, though, so you're responsible for your own public face, and if you know what's out there and you can speak to the things that are out there, you'll be in a good place. And for example, if a school was searching for you and the first thing that came up was something published from your university in a newsletter about a big service project that you had led, that would be a great thing to come up, and it certainly would not hurt your chances for admission. So things that you can do, just be aware of what's online, Google yourself, be able to speak to anything that comes up. Obviously, keep it clean, make your accounts private so that they aren't as easily searchable, and have your settings set up so that you're approving tags. If you have friends who are tagging photos of you or tagging you in a specific location, just be sure to be able to monitor that. Don't share your password, sign out of public computers. These are just good practices, but it's good to think about even before you're thinking about applying to med school. So what policies, dates, and information matter? I mentioned the medical school admission requirements site. This is a database. It's the only comprehensive resource with data pulled directly from the AMCAS application, the MCAT exam, and it's directly from the medical schools too. It's populated and updated every year. I'm not able to demo the site right now, but you should be able to see what it would look like. So in this case, you could look at, do you want to narrow your search by public universities, private, location or class size. You can also type in the school name and you can look at the specific school. In this case, I typed in UC Davis, or Davis, so UC Davis came up. And all of the tabs you see along the left side here, you can click on and get more information about the school. The summary tab has the mission statement, so that's a great thing to check out to see what each university is hoping to see from their students, and these are usually also available on the school website. Here you can see the median MCAT and GPA scores from students who were accepted the previous year. You can look at the required pre-medical coursework. So like I said, every school has different requirements and different recommended courses, and in this case you can see which chemistry courses, computer science might be recommended, it's not required. It's different for every school, so it's nice to be able to look at each of these schools. You can look at them side by side and see based on your recommendations. And then here you can look at the matriculation data for the first year class. So you can see it's broken down by in-state, out-of-state, and international. For an example, last year, just under 6,000 students had a verified application, and ultimately 100 students matriculated. So you can see it's certainly a competitive process, but you can look at these numbers for every university. This database, it is something that you pay for. It's a subscription. It's $25, but it's a good way to be able to browse, sort, and compare and have all of that information. Do you have a question? The name is Medical School Admission Requirements, and you can go to www.aamc.org/MSAR. And that will be up on the screen before this presentation is over, so you can write it down. Okay, so which schools may be a good fit? Certainly looking at data like we were just talking about is one way to start thinking about that. But just like when you applied to your undergraduate university, you're considering the mission, the location, do you want to be in-state or out-of-state? There's a lot of other factors to consider with a med school too that you may not have considered with your undergrad. So for an example, regional campuses, if the university is based in one place, they could have a regional campus that's in a different state, so it's just good to be aware of that. And like when I was talking about the mission statements, you can see different priorities. You can also, in the medical school admission requirements, look at the research opportunities where volunteers, basically what was required and what was recommended and what the students do once they're in med school as well. Not on the slide, but it's also important to consider what are your skills, your experiences, your career goals. It's better, I think, to think about you as an individual and how that's going to align with a med school that will help you determine the best school that's going to be the best fit for you. So what is the medical school interview like? It varies. There are different types. I'm going to tell you about a few. By the time you're getting to the stage of a medical school interview, it's good to know that you have already impressed someone and they've invited you, and that's very exciting, and pat yourself on the back because it is nerve-wracking, but they've seen something very positive in you that they want to talk to you more. One style of interviews that is relatively popular is the multiple mini interview, the MMI. And this style is basically, it's usually about 2 hours total, but you have 6 to 10 very short interviews with different people who are interviewing you. So, and they're not quizzing you necessarily on knowledge, they're looking more at how you respond, how you communicate, how are you gonna interact with patients. And the good thing about these interviews is that because you're working with 6 to 10 different interviewers, one impression of one interviewer is not going to completely sway the decision. So if you were to have your first, if you feel like it didn't go so well the first time, that's okay. You can just wipe the slate clean and have a fresh start with the next person who's interviewing you. So that's a nice option. There's still a standard one-on-one interview where you would be interviewed by one person, or a panel interview where you're going to be interviewed by a few different people. Sometimes there's a Skype or video option, so maybe you're not on site at first. And then one thing that I wanted to mention, usually an interview is going to be a very positive experience. You should be happy and hopefully feel really good when it's over. Occasionally, you may be faced with a question that you think, is that an appropriate question? Is that something that I should be asked right now? Possibly it's a stress question that's designed to see how you're going to react under pressure, and that's okay. But if you encounter an inappropriate question and you feel like, they probably shouldn't be asking about things like my faith, do I want to have children in medical school? Questions like that are absolutely off limits. And it is appropriate to decline respectfully to answer a question like that. And we have some more information available about how to handle those situations, what kind of questions are inappropriate. But the important thing to do is just report it right away. And usually before your interview even begins, you'll be briefed on how to do that. That's what you should do. So where can I find inspiration and advice? Lots of different resources, completely free and available to you through the Association of American Medical Colleges and the Aspiring Docs program. One of those are inspiring stories. So we have a whole library of current medical students who are talking about different situations. Maybe they overcame an illness or an injury. They had a particularly challenging background leading up to going to med school. We have one that we added earlier this month where a student applied 4 times before being accepted, and so she talks about what that process was like, what she would have done differently, and what it's like to retake the MCAT exam. So sometimes reading things like that can be very encouraging and help you. You might relate to or identify with a particular student that we have featured there. We also have the Aspiring Docs Diaries blog, which I've spoken with a lot of you about over the past couple of days. If you don't have the address, that will be up shortly too, but this is a blog where we have current medical students who are just blogging about their everyday experiences in med school, so things that are going really well, things that they're stressed out about. So that's a really great way to be able to see what other med students are going through right now, and of course you can leave comments on the blog and contact us that way. We have the AAMC pre-med social media, so anytime that we add a new inspiring story or we have a new blog post or anything that is updated and new, you can find out right away. We have MCAT updates and AMCAS updates, so be sure to follow us on Facebook and Twitter. I'll put that up in a moment as well. And then we have a new series. This is brand new. It's called Ask a Med Student. It's a video series. Right now we have 8 videos with different questions. So students who are applying to med school can ask a question like, what's a typical day like for you? How often do you interact with patients? What's that like? And then we have current medical students who are responding over video, and we have a library that we're building. So if you have a question that you would like to ask a med student, we would love for you to do that. Leslie is here. She's in the front row today, and if you want to come by after, we can get your question and go ahead and get that ready, and then in the future we'll have a med student respond to that on the video, and it'll be up on the website as well. So these are some of our AAMC pre-med resources. I know somebody asked about the medical school admission requirements. There's 2 products, actually. One is the official guidebook, which I have here. You can take a look at. We also have the website, which is that database where you saw the screenshots for. The official guide will talk to you about how to structure your undergrad coursework, just give you an overview of the whole medical education process. It covers the MCAT exam, the AMCAS application, the admissions decision, financing. It's kind of a good overview. It's a really weighty chapter guidebook that you can get in print, or you can get an ebook. And then the medical school admission requirements database we looked at, that's where you can actually browse and compare. You can leave notes, sort schools, things like that. The aspiringdocsdiaries.org, the first thing there, that's the blog. And then we have the Aspiring Docs website. That's where you can find all of those fact sheets and more questions. That's also where the inspiring stories are held. And then you can see our Twitter and our Facebook there. I'll give everyone a chance to write down anything you want to write down. But that's it. That's what I have today. And if you have questions, we don't have the microphone set up, but you're welcome to come down and ask me a question. I'm happy to answer anything that you have. Okay, question?
I'm actually pretty loud, so I don't even know if I'll need a microphone.
Okay.
Can you hear my question?
I'll repeat your question.
Okay. My first question is, excuse me for coming in a tad late. I didn't see the first five, and I was wondering if you had a paper for which I could look after. And I also have a question about a gap year. Whichever you'd like to answer first is fine.
Okay, so the questions were about the first 5 questions that we mentioned. If you came in late, if you missed any of those, I'll find a way to get those distributed to you. If you want to come down and see me and Leslie, we'll get your email address. We can get those to you. The second question was about a gap year. So students decide to take a gap year for lots of different reasons. Maybe it's to address a particular academic deficiency. Maybe they want to have some more experience, so you either want to volunteer or you want to work in the medical field for a little bit. They're very common. Over half of students will take a gap year. It may be 1 year, it may be longer. And there's some formal programs that students choose to enroll in, like a post-bac, which is specifically designed to support that transition into med school, but there are less expensive ways. Go ahead.
What really is, okay, like I didn't mean like in general, since you're gonna answer the beginning, but I didn't mean like in general, like, oh, what is a gap year? I was wondering if you could explain why I was thinking about doing a gap year, if you think that was wise, or if you can direct me to someone else who can tell me if it would be a wise idea for me to take a gap year.
Okay, so the question is specific to this individual. Is it a wise decision for me to take a gap year? I'm not in a position to answer specifically for you. I'm happy to talk with you more about it afterwards, but if you're considering a gap year, if you're not sure if it's a wise decision for you, I would connect with a pre-health advisor, and again, if you don't have one, you can work with one through the National Association of Advisors in the Health Professions. I can put that website up here again, maybe. I'm sorry, what was the question? No, I'm not pre-med, but I can direct you with some other resources too. But specifically for your individual decision, it's best to work with an academic advisor. They'll know, you can talk with them about your coursework, your background, your reasons you may be considering. They've advised a lot of students in the past, so they can tell you how it's fared for other students in your position. You're very welcome. Any other questions we want to do right now? Okay, well, if you do have questions, feel free to come by and ask. And again, if you have a question that you'd like to ask specifically for a medical student to answer, we would love to go ahead and collect that question now. And we can do it right now, or you can come by the booth this afternoon as well. But thank you so much. It was great to talk with all of you, and have a great rest of your conference.